So you battle addiction, but you want to be treated like a human being when you go to the hospital? Should you be? Yes, 100% you should be. And I worked in an ER for 5 years. I've done ICU. I'm an ICU nurse practitioner, and I just want to talk about a study that I just read. So this study came out in October of last year, and it has to do with substance use disorder care for the treatment of people who inject drugs and infectious disease being involved. If you've ever been an IV drug user and you've been admitted to the hospital with, say, an infection, endocarditis, bacteremia, you end up having to do 6 to 8 weeks of IV antibiotics. Nobody wants to stay in the hospital that long, especially if the hospital staff are not treating you as a human, or they're not treating your addiction appropriately, and many times just ignoring it from the get-go, right? There's this push now, right? We need to be getting these people, if they're agreeable to it, like on Suboxone, if they suffer from opioid use disorder, when they come in patient and they need long-term IV antibiotics. This is why so many patients leave against medical advice, because they go through a withdrawal, we're not treating it appropriately, and they potentially are killing themselves by not getting this treated. And we are failing this population when it comes to our medical care. Just being honest. So at a county hospital in Miami, Florida, they actually created a substance use disorder and infectious disease clinical team. Pretty cool. The conclusion of the study showed a 45% decrease in readmission rates within 90 days. That's a pretty phenomenal number. Let's talk the focus of this team. The focus of this team is to treat pain, withdrawal, while you're in the hospital, along with giving you the appropriate antibiotics that you need to clear the infection. And once you are discharged, this team will continue to follow you up to 90 days after discharge. I always talk about advocacy. They also are advocates for you in that hospital. To me, as a provider, I would like to see something like this implemented in every hospital. I plan on writing a blog about this study in more detail, because this is just kind of the little snippets from it, and I'm probably going to talk about it on my podcast if I ever get to recording another episode soon, though. But yeah, great information, you guys. Ask questions and I'll see if I can answer them.